Waiting until your face looks really bad before considering a facelift is one of the most common assumptions of what counts as good strategy. As a facial plastic surgeon who sees many patients unhappy with how their face is sagging, I hear many of them say they were told to wait until they see significant sagginess, only to find their options later were more aggressive, more expensive, with longer recoveries. Misunderstanding this leads to rushed decisions, unnecessary fear, and results that don't feel like you anymore. By the end of this video, you'll understand what early intervention facelifts actually are, who they're designed for, and how to know whether doing something sooner or waiting is the smarter choice for you. Most people think facelifts are about pulling the skin tight when aging gets out of control. That idea is outdated. Facial aging doesn't suddenly happen in your 60s. It's gradual. Volume shifts, skin quality changes, the deeper support structures slowly relax. Finally, the one factor you cannot control is your genetics. Everyone ages at a different pace, even if you're doing everything right from lifestyle perspective. You're eating healthy, exercising, taking care of your skin, etc. Early intervention facelifts, often called mini facelifts or maintenance lifts, aren't about dramatic change. They're about addressing smaller issues while the face still has good elasticity and structure. In your 40s, the face usually doesn't need major lifting. What it often needs is subtle repositioning and support. That allows the face to age more slowly and naturally over time, instead of reaching a point where only a large, more invasive surgery can help. We are seeing more people start to realize non-surgical options have real limitations and even potential problems. There is definitely an increased sense of quote-unquote filler fatigue. Fillers exploded in popularity around the 2010s. There was even excitement regarding the liquid facelift. This is where fillers are placed to attempt to lift your face. I too was part of this trend. What I quickly realized was there were significant limitations to what fillers can do in terms of lifting the face. You really need good elasticity in order for fillers to have any chance of some lift. But the challenge is, by the time many patients in their 40s are already beginning to have enough loss that fillers can't lift very well. By this time, you'll notice some lifting. Often you'll have an overfill look. And this challenge gets worse with advanced age. In addition, now with more years of data, we're also starting to hear reports of filler migrating outside their intended sites, and fillers are even lasting longer than advertised. Threading is another popular option, but these also don't adequately address the sagging you're seeing. Now the concept sounds fine. Instead of a scary surgery, let's just lift your tissue with dissolvable barbed suture. Sounds okay on paper, but implementing this in real life is another matter. For one, as a surgeon who does a lot of facelifts, I know how much tissue needs to be lifted. From a biomechanical perspective, it's just not reliable nor effective to lift that amount of tissue with just a few sutures. Furthermore, I've heard these surgery procedures are not fun. They don't last that long and also are not cheap. I do concede that threading is very popular in the world, but in my opinion, that's because there are many more non-surgeons offering rejuvenation procedures. I bet a majority of surgeons are not fans of threading. You can also try another super popular option, and that's to try energy-based devices. You might have heard names like O-Therapy, Morpheus 8, M-Sculpt, FaceTight, etc. All these goals have one goal: to deliver controlled energy deep into your face to hopefully cause enough scarring such that scarring will pull up your face. I know there's a role for these devices as evidenced by their immense popularity. Most people don't want surgery, and these devices offer potential to lift your face without surgery. But these also don't last long. I've heard many complain results only last a year. They're also expensive. But for me, the number one reason I'm not a fan is now we are getting data that many of these devices are destroying fat and causing real damage in the deeper structures. Many plastic surgeons, and I've seen this in a couple of my cases, that when these patients do eventually get a facelift, their tissues are more scarred. Facelift surgery becomes a bit more challenging. With more scarring and disruption of normal anatomy, complication risks increase. All these reasons are why I see more and more patients coming in for a mini facelift. A mini facelift in the right patient will achieve the best natural looking result while lasting about 10 years. The main obstacle really is the fear of surgery and the longer recovery required compared to all the non-surgical options I just mentioned. Many of my patients who get a mini facelift tell me the natural long-lasting results achieved with the mini lift is key. Also, many conclude that although the upfront cost of a mini lift is higher, in the big picture, it's a better investment. With non-surgical options, you have to spend thousands every year. Another misconception is that doing something earlier means you'll quote-unquote run out of options. In reality, it often preserves options. Small procedures now can delay or reduce the need for larger ones later. Another common question is a mini lift permanent? Aging doesn't stop, so nothing is permanent. But improvement is real and long-lasting. You're essentially resetting the clock, not freezing time. And then there's this question: what if I do nothing? Sometimes that's the right choice. But for some patients, waiting means the solution later becomes bigger, not simpler. The fear is that starting earlier leads to a lifetime of surgery. The reality is that thoughtful, conservative care often leads to fewer more controlled decisions. Early intervention isn't about chasing youth, it's about avoiding extremes. Now, that doesn't mean you shouldn't wait until you see more significant aging. In fact, I think this is another reasonable option. The main advantage of waiting longer is you will definitely see more dramatic changes. Even though the current trend is natural, subtle results, that doesn't mean wanting to get dramatic results is wrong. It's a personal preference. The best facial rejuvenation plan isn't about age, it's about timing, anatomy, and goals. For some patients, early intervention makes sense. For others, waiting is the right move. Good care is about choosing the right option at the right time, not rushing or following trends. If this helped clarify how to think about facial aging and surgery, that's exactly the understanding I want patients to have before making any decision. Please make sure to like the video and subscribe for more clear, patient-focused explanations.